Hello everyone, my name is Shaprova. I have recently passed BSc Nursing from Rajiv Gandhi University. So today I just opened this new channel uh, regarding the nursing topic. So I will cover the basic nursing topic, will help you to the all student to understand and to recall. So I will make the topic easy to understand related the nursing medical knowledge as well as health safety study tips and career guidance. So my goal is to expect complex topics simple, practical and useful for students and healthcare professionals. So let's start. So today's topic is Glasgow Coma Scale. So basically we are using in the neuro ICU. So why we use that? Because Glasgow Coma Scale is the scale which help us to determine the patient condition and unconsciousness. For example, one road traffic patient has came. Okay, so you are performing assessment for the particular patient, that road traffic accident. So what will you do? You have to check the patient's verbal response, eye response and motor response. So I will play a funny game to understand and to remember this. First it is comes to the eye, because we can see by eyes, right? So whatever we want to understand, so we see by eyes. So first we will assess by the eyes only. So first eye is the 4. So what will count? 4. 1, 2, 3, 4. So 2 eyes, 2 into 2, 4. So 4. First score will be 4. So first we will check the eye response, that patient is open their eyes normally or spontaneously. Okay, like us, we are opening our eyes spontaneously. So first we check that patient's eyes spontaneously opening. Second, it is for the to speech. It means that if patient is not responding spontaneously, then we go for the speech, that hello sir. So suppose this is a patient. So for example, this is my patient. Okay, so I don't have anything. So just let's imagine this is patient who came with road traffic accident. So we are nurse, so we are going to assess the patient condition and consciousness. So we first will see the eyes. Do you know why? Because eyes are first we observe. So eyes is the first come in our face. Okay, so first we will check spontaneously opening. So eyes are spontaneously like us, it is opening spontaneously. So if it is not, so we will go to 3. Next 3 to speech. Hello sir, hello sir. So is he responding the eyes by speech or not? So we will score it 3. Then we will go to the pain. So if speech is not responding, then we will go to pain. So we will pinch the patient hand or chest. Okay, so to responding their eyes. So if it is still not responding, so we will go to 1, that is no response. Next, so eyes are done. So we remember eyes has 4 points. First spontaneously, to speech, to pain and no response. Next is the verbal. So after eyes, what is come? Our lips. So how do I communicate with others? So next, verbal response. So verbal response comes under the 5 points. We give it 5 points. So 4, 5. So 5 points. So 5 points. First is 5 is oriented. Does this patient oriented to time, place and person? Like, sir, where are you now? Sir, do you know which place is this? Sir, what time it is? So these all are the question we can ask to assess the verbal response. That speaking, the patient is speak normal. Next, inappropriate word. So if patient is not verbalizing normally, then we'll go to the 4, that is confused. That patient is where I am, what it is, what, like confusing verbalization. That is 4. So 5 is orientation, 4 is that confusing. Next it will come to the 3, that is inappropriate words. So patient is not confused, but patient's verbalizing. When patient start to verbalize, that time patient is words are not like it is mixing, like this inappropriate words are using. That is comes under 3. So 5, 4, 3. Next 2 is incomprehensible sounds, like sir, what, who are you, what is your name, hello sir. So what patient will say, or there is no meaning of sign, patient will be respond. So that is 2. Next is 1, that is no response. So whenever comes to 1, that is no response. So GCS scale is very important, guys, for your NOTSET exam or any government exam. So they ask about it. Next it is comes to the motor response. So motor response means, look, this is my octopus, so this is now is a patient, so it has so many motor like legs, hands, and so many wings, right? So but in our body, for human beings, we have four limbs, right? 2 hands, 2 legs. So we will check for the motor response, that patients how to responding their limbs. So first is the 6. So how do you notice that how it is increasing, like 4, 5, 6. So for motor response we'll go to the 6. So 6 points. So first we will go to the we will give the 6 points to the patient if the patients obeys commands, like sir, move your hands, so he is responding properly. Sir, move your legs, so he is responding properly. So that is obeys command, that is 6. Next it will comes to the 5. So 5 is localized pain, like hello sir, move your legs, so patient is not responding. So what will go we will give the pain. So we will give the pain. So patient what will do, patient only withdraw, only respond that hand where we give the pain. Okay, like this hand I am giving the pain, so patient will moving. Next is it is the withdrawal from pain. So withdrawal from pain means that patient is withdrawing, that this hand is paining, so patient is withdrawing, like me. So I am so the patient is not responding verbally. So it happens when patient is not responding verbally, it happened. So while we giving the pain, so in hands or any like bodies, any part of the bodies, so patient what will do, withdraw their parts. And the difference between the localized pain and the withdrawing from the pain, so patient what will do, that I am giving pain on the right hand, so patient will respond to the hand with another hand, that like this they will remove your hand. So next is the withdraw from the hand. So this hand I am giving pain right hand, so patient will be withdraw their hand. So that it means that don't give pain. So that is the 4. Next is the abnormal flexion and abnormal extension. So we all know what is flexion, right? This is flexion, this is extension. Extension is the away from the midline, and extension is the extension is the away from the midline, and flexion is the towards the midline. So we all know about it, right? So next, abnormal flexion, that is also called decorticate, that is gives the 3 points because patient is abnormally flexed, like this, flexed. All the limbs are flexed to the body, to the midline of the body. That is 3. If patient is abnormally extended like this, extended, so that is decerebrate. 1 is no response. So these all about the Glasgow Coma scale. So one more important thing that you all can remember, that 3 EVM. So here that is very easy to remember, EVM. So that is a mnemonics to remember, that EVM. eye verbal motor. Minimum score is 3 and maximum score is 15. So if the patient range is 13 to 15, mid brain injury, then 9 to 12, moderate brain injury, and less than 8 or equal 8. So less than 8 we consider 7, less than 7 and 8. So severe brain injury. So if the score is 3, so you know na, no response, no response, no response. So we consider it as a deep consciousness or death. So GCS scale is very important, guys, to determine the brain injury as well as monitor changes in neurological status. So when you will work in the hospital, if you, especially in the neuro ICU or ICU where neuro patients are admitted, or surgery like craniotomy, spinal cord injury, or like any brain trauma, stroke. So this is a very vital for GCA. So you have to remember it and you have to assess immediately. So you have to note it down, like in nursing note. You have to note it down that how much GCS score. So you have to do that for that severe brain injury, 2nd hourly, 4th hourly, as per doctor's instruction. You have to do that. When doctor come for that round, so they will ask you, so sister, what is patient's GCS score? So you have to respond it immediately. So GCS score is very important. Thank you.